Hello, this is Dr. Grande. Today's question is, what is the difference between bipolar I and bipolar II? So to answer this, we first need to understand what is bipolar. So bipolar means that an individual had at least one major depressive episode and one period of mania or hypomania. So to get a bipolar diagnosis in the first place, both of those have to be present. A major depressive episode and what we refer to as a manic episode. The difference between bipolar I and bipolar II comes only on the side of mania. It doesn't have anything to do with a depression. So somebody with bipolar I and bipolar II, you have two people that have those disorders, they can have equal levels of depression, and it can be severe. And the depression can lead to psychosis. It can be that severe. On the mania side, that's where we have the difference. For bipolar I, it's a manic episode, and with that manic episode can be some of the things we might expect. A need to be hospitalized, psychosis, behaviors that disrupt functioning in a significant way. With bipolar II, you don't need to have mania present, but rather hypomania. And hypomania is a less severe version of mania. We typically think of hypomania as not requiring hospitalization, not involving psychosis or delusions in any way, and not having a significant effect on functioning. Meaning, theoretically, somebody with hypomania could continue to have normal social relationships, could continue to go to work, although they might have to make some changes, some adjustments, they could still essentially function. Now, this distinction between bipolar I and bipolar II, again, is only based on the mania. And what can happen here is that manic episodes can go unreported, so somebody may get a diagnosis of bipolar II, but mania was overlooked. There's evidence for hypomania, but not mania. Another thing that can happen is there can be a period of elation and euphoria that doesn't rise to the level of hypomania, but because there's depression there, someone diagnoses bipolar II. A mental health clinician looks at it and says, well, this may be hypomania. May not be. If there's no hypomania, that would just be depression. So it's a little bit of a tricky diagnosis because you have to have clear evidence of a hypomanic episode, but not evidence that supports mania. Now, another point here about these two disorders is sometimes there's this conception about them that bipolar I is fairly dangerous and bipolar II is not as dangerous. That's not entirely true. Yes, with bipolar II, you're not going to have mania that's typically as dangerous, although it can still be dangerous. But again, the depression side could be just as severe with bipolar I or bipolar II. And we do worry when somebody's in a depressive state, and of course we worry when they're in a manic state, both. But with bipolar I and bipolar II, with that depressive state being potentially equal in intensity, it's difficult to say that bipolar II is necessarily safer. Both conditions convey a degree of risk, and both necessitate mental health treatment. I hope you found this description of bipolar I and bipolar II to be helpful. Thanks for watching.